activity where the students from third year BME going to have a debate on the topic infusion pump and syringe pump. So where the students going to discuss the pros and cons on infusion pump and syringe pump. Let's see the discussion.
So, warm welcome to faculty members and my fellow opponents. So, we are going to speak on the topic infusion pump is a superior choice. So, infusion pump is a device which changes the pathway of delivering medications to patients. It is most versatile device where it is precise, efficient and also safe. These three factors are very non-negotiable in medical devices and it serves in abundance. It is not just a device but it is a lifeline which is used in almost all clinical settings, especially in intensive critical care. So this is about a brief introduction on infusion.
Then how about syringe pump?
Syringe pump is a medical device that is used to control and precise the amount of drugs delivered to the patient by using and operating for the mechanism of plunger of the syringe.
Okay, you are going to oppose this point. Like infusion pump is superior than syringe pump.
It offers many things. First of all, it offers higher volume delivery. It can deliver higher volume fluids for a long period, which is ideal for hydration and blood transfusion. And it also offers multi-channel drug delivery. Many infusion pumps allow simultaneous delivery of multiple medication via different channels and less frequent frequently. It uses large volume bags so that it reduces the interruption compared to syringe pump. While clinical usage, it mainly used in suitable for critical care, post-surgery wards and emergency.
It's good value. So what is the point you want to defeat this?
So the reason for choosing syringe pump is that it could be highly precise. Even it could be excellent for the small dosage delivery, and it is compact and portable in the transportation of ambulance, and we can also use it in home care. And it could be a lower risk of infusion because even small volume can accommodate large dosage delivery, and it could be cost effective. And the next thing is it is ideal for potent drugs like anesthetics, infusion, and ideal for potent drugs like anesthetics, insulin, and drugs.
I agree to my opponents that it is suitable for microdoses, but considering the factor of volume plus capacity, I feel syringe pump couldn't do that. Let's take an example where syringe pump is used for large volume deliveries, but you need constant refilling and also changing of syringe, which can make the treatments delay and it could cause infections in the patients, and there are risks of life when we are in critical care.
Yes, it's valid point here.
Even though infusion pumps are good at volume, not every patient need large dosage or large fluids. Especially in intensive care and critical care, we'll be using a small amount of liquids. And infusion pumps are bulky and expensive. So I think sales pump is the best.
How about maintenance aspects of infusion pump and syringe pump?
So as of infusion pump, the maintenance is actually very easy because it has self-error checkings. So it can notify the particular instrument on prior manner so that it will be easy for servicing the same equipment. But as of syringe pump, there are different kind of errors arising due to the size, type, and also about the dosages. And also the plunger sections may affect. And also embolism is another critical factor where if dry syringes are passed on to medical equipment, then there is a risk of embolism.
So even though we will have some disadvantages in syringe pump, it could be cleaner and cheaper for services. But in infusion pump, it could be expensive due to the spare parts waste, and there are malfunction due to sensor misaligation and some despite.
I think now we were in the end of this debate. So the both opponent people they have discussed very nicely about the pros and cons of infusion pump and syringe pump. So as a conclusion, I would like to say the both infusion pump and syringe pump, whatever may be, they both are come under the category of drug delivery systems. So in addition to syringe pump and infusion pump, we have plenty of different types of drug delivery systems are there. So each and everything has its own pros and cons, and based on the applications and based on the patient conditions, where we have to use how we have to use that everything it depends. So each and everything has its own functionality and performance in their better way. Thank you.
Thank you.